Welcome to this short video for long-term care preceptors. This is a 5-part series of videos for preceptor education. This video is part 1, Role of the Preceptor in Long-Term Care. The others are part 2, Leadership and Professionalism, part 3, Communication, part 4, Opportunities for Preceptors, and part 5, Resources for the Preceptor. This first video will provide an introduction to the role of the preceptor, key attributes, and learning approaches preceptors can use with new students. There are a few key components of preceptorship. Firstly, it's a formal process, often organized by an academic institution, like a university or college, and a healthcare organization, like a long-term care. Secondly, it involves a relationship between an experienced and competent nurse with a novice learner. Third, it is a time limited experience, often lasting for the duration of a few weeks or months. The goal is to support the learner to acquire new competencies required for safe, ethical, and quality practice. The role of the preceptor is to facilitate learning for students or new staff. This is a critically important role to not only support students to learn new skills and knowledge, but also to become socialized to the profession of nursing. The experience new nurses have during their clinical experiences often shape their impressions of the nursing profession and whether they will come back to a clinical setting in the future. As an experienced registered nurse myself, with over 20 years' experience, I think back to the many preceptors I have had the pleasure of learning from, while as a student and as a new nurse in a new role. These preceptors were certainly experienced and competent nurses, had strong leadership and conflict management skills, and were expert critical thinkers and problem solvers. They were fantastic clinicians, and we're going to elaborate more on these skills over the course of the next few videos. But what I remember the most was their enthusiasm for nursing. They showed me what a compassionate and knowledge based profession nursing is. I remember their patience with me, as it took 5 times longer to complete a new skill, and their positive attitude. Regardless how busy, how stressful the shift was, or how short staffed, they were always positive and encouraging.
Hi, I'm Lindsay Cerna. I am a nurse practitioner who works in Sault Ste. Marie, Ontario at the FJ Davy Home. I am the full-time nurse practitioner here, as well as the Best Practice Spotlight Organization lead. I have been a preceptor for a number of years for both RN students in 3rd and 4th year, as well as nurse practitioner students. I initially agreed to be a preceptor when a colleague at the college had reached out asking if there were any nurses available. There has been a lack of available nurses, I guess, in long-term care willing to share their experiences or have the time to be able to have a student. So I thought it would be a unique opportunity to share my role as both the nurse practitioner and Best Practice Spotlight Organization lead, which is a new role for me. I feel it's important to help nursing students to gain experience and knowledge and kind of see what long-term care is about. I know for myself, I did not have a lot of experience in long-term care as a student. It wasn't until I started working that I realized that this was something that I really liked because I saw such a small part of it before. Primarily just doing bedside care, I think, when I first started. To prepare as a preceptor, I reached out to other preceptors in the past and management of our home to see what kind of experiences they had had and how they prepared to be a preceptor. I contacted colleagues at the local college and the course professors so I could review what the expectations were, what were the course objectives, and I like to review with my students what their goals are for the placement. Each student has their own unique goals, and I like to make sure they have done an assessment on their own so we can try to reach those goals and they can get the best learning experience possible. I think it's really important to reach out to partners, so that could be colleagues within the home, to help find learning experiences, because my role is unique. I do like to make sure that students can have the opportunity to do medication passes with the RPNs and specialty either dressings or assessment with their registered nurses in our home as well. I think kind of all of us working together can provide one of the best experiences you can for students so they can get a positive experience of working in long-term care.
Preceptoring and creating a positive learning environment isn't an individual responsibility. It takes the support of a team to provide a comprehensive learning experience. Once you are aware that a student will be conducting their clinical placement in your long term care home, I would encourage you to inform the team that a new student will be arriving and to seek opportunities amongst the team to provide a variety of learning experiences, both within the nursing department as well as with interdisciplinary team members. Match these opportunities with the student's learning objectives. The preceptor's role is to help the student learn and succeed. There are lots of ways to do this. I'll talk about some of the ones outlined in this list. Utilize a learning together approach. No one expects you as a preceptor to have all the answers or to know everything. Utilize your colleagues, guidelines, or other resources to demonstrate to your students that nursing is a knowledge based profession which involves continuous learning. Acknowledge challenges. There is no such thing as the perfect shift. Situations may arise that are sudden and unpredictable, such as a sudden change in resident condition, uncomfortable encounters with residents or families, or conflict amongst the team. It is important to debrief when situations like this occur and address the situations head on and talk about what went well and what could have been done better. This is an important part of role modeling self reflection. Find opportunities to make learning fun, engaging, and interesting. Creating opportunities like shadowing experiences, participating in meetings, and learning new skills and techniques are great ways to bring variety to a clinical experience. But don't forget that something simple, like joining a resident for a round or two of bingo, can show your students the importance of developing a therapeutic relationship, the importance of socialization to residents' mental health, and reduction of social isolation. These are just as important to providing a holistic approach to nursing as the clinical skills.
Becoming a preceptor is an excellent opportunity for growth, leadership, and professional practice for the individual. Becoming a preceptor in long-term care is an opportunity to collaborate as the entire organization to develop that program. Not only is the entire leadership team, senior management in support of the preceptor, but also the system partners, the healthcare system, and the entire organization and your colleagues at the same time. As a preceptor, you may take on several components of clinical practice to work with the new grad or the student that you're preceptoring, such as wound care, infection control, looking at an effective fall prevention program, pain management, pain assessment and management, looking at management of responsive behaviors for delirium, dementia, and depression, to name a few. It's also an opportunity to engage all of your system partners that are internal and external to the organization, such as your pain consultants, your psychogeriatric resource consultants, and your nurse practitioners, to name a few. It's also combined team effort of the entire organization, where you do have the support of the entire leadership team and of course your colleagues and your team members on your unit at the bedside. If there is an opportunity to become a preceptor in your organization, I invite you to take that on. It's an excellent opportunity for your own professional development, growth, and reflective practice. I'm Saima Sheikh. I'm an RN in long-term care for over 25 years in the areas of executive leadership, education, quality, best practice, and innovation. Thank you.
Thank you for taking the time to watch this video. There are 4 other videos in this 5-part series. Feel free to review them on the RNAO website and share them widely with your colleagues.